got on here. Thank you for making time. I know it's not lunchtime there. It's breakfast time, I guess. So I'm inviting everybody.
Yeah, it is. It's 12 o'clock, and we're just going to be mindful of everybody's time.
Great.
Again, welcome everybody. Welcome to the Florida Asthma Coalition Home Visiting Work Group Lunch and Learn webinars. Thank you for coming and being with us today. We have Dr. Debra Weiss, who is the co-chair of the Florida Asthma Coalition and co-chair of the Florida Asthma Coalition Home Visiting Work Group. She has an MA and an EDD from Teachers College, Columbia University, and is a professor and a certified health education specialist. Her master's degree was in stress management. She did a meta-analysis of evidence-based research showing the benefits of meditation in reducing anxiety. She created a CD and a lecture, which she presented to executives at Time Inc. New York. For her doctoral research, she focused on asthma management. Her dissertation on managing asthma on college campuses was replicated with a team from Texas State University and won a national award. She hopes that you all enjoy the webinar. And if you would like to learn more about stress management techniques, subscribe to the new upcoming YouTube channel, which will launch in September. So thank you again. I'm sorry I didn't introduce myself. Wanda Rodriguez Dunham, and I'm the co-chair of the Home Visiting Work Group for the Florida Asthma Coalition, as well as the Asthma Program Manager for the Florida Asthma Program. So again, welcome and enjoy the webinar.
Thank you so much for the introduction. I'm Dr. Debra Weiss. I'm so happy to be here today. I wanted to invite those of you that have just joined. If you are new to Florida Asthma Coalition and the Home Visiting Work Group, please put in the chat where you are zooming in from, and we hope that you will become regular attendees of our Lunch and Learn webinar series. We started this last year. It was actually my idea, and Dr. Rodriguez Dunham and I have worked closely together to implement it. There are many topics that we thought would be of use to people who have asthma, allergies, and other respiratory disorders. So today our topic is stress management, the use of complementary therapies in asthma management. Okay, there we go. So before we begin, we really need to know what the definitions are. The word stress is bandied about, it's used, oh, I'm stressed out, oh, there's so much stress. What do we really mean? It's almost become a meaningless word because it's so overused. So I want to go back to Hans Selye's definition and then a more recent one from the NIH. Hans Selye was one of the original researchers doing groundbreaking research in stress management. He defined stress as the non-specific response of the human organism to any demand placed upon it. So what does this mean? In modern parlance, a physical and emotional reaction that people experience as they encounter challenges in life. These challenges are known as stressors, S-T-R-E-S-S-O-R, stressor. Now, what do we mean by complementary therapy? There's been a lot of confusion about that. Oftentimes you see CAM, C-A-M, complementary and alternative medicine. That's not what I'm talking about today. I'm talking strictly about complementary therapy. That complementary therapy is a non-mainstream approach that is used together with conventional medicine. In contrast, a non-mainstream approach that is used instead of, in place of conventional medicine is considered alternative therapy. We are not addressing alternative therapy today, so I don't have anything to say about it, positive or negative. We've all tried a variety of things. Today, my focus will be on complementary therapies. Now, when we have complementary therapies used with conventional medicine, we have what is called integrative health. And furthermore, integrative health focuses on the whole person. We live in a very specialized society, and oftentimes we go to many specialists, medical specialists, and of course, they look at the specific organ or disease that they're dealing with. But in a whole person approach, we look at the whole lifestyle. Is the person eating well, sleeping? Are they exercising? Are they doing unhealthy behaviors? Do they vape or smoke? Are they drinking excessively? We look at the whole lifestyle factor. Are they living in a hazards, excuse me. I was up very late. My semester starts tomorrow at 8 a.m. and I have a new course, so excuse me if I'm a little tired today. Anyway, so we look at lifestyle factors. And for those of you that are health educators like myself, lifestyle factors contribute more than 50% to a person's health status. There are inevitable genetic factors and others that we can't overcome, but we can change our lifestyle factors and have a huge impact on our health. Okay, now there are different kinds of stress. So believe it or not all stress is bad. The good stress is called eustress, and it's a response to a positive stressor. That could be something like having a baby, getting married, getting a job promotion, winning the lottery. These are positive stressors. They place demands on you, but it's something you wanted, so it's a good thing. Now, distress is what we're more familiar with, when there's a response to a negative stressor, like the loss of a loved one, serious illness, like long COVID, or like asthma, the loss of a job. Stress can also be short-term or long-term. So when it's short-term, we call it acute. When it's long-term, we call it chronic. And those of you that have asthma, COPD, cystic fibrosis, severe allergies, those are chronic diseases. They don't go away. So that in itself is a source of chronic stress. Now, stressors can be internal or external. So internal stressors are unhealthy conditions within your body or mind. It can be a physical disease or disorder, or it can be a mental illness or disorder. So you see there, asthma again falls under the internal stressor. We also have mental health disorders like autism and bipolar disorder. And then sometimes the chronic stress can create unhealthy mental problems such as severe anxiety, phobias, and so forth in formerly healthy people. So the body and mind are intimately tied together. And external stressors, one of them that we're all facing still is COVID-19. After 2.5 years, it's amazing. It's still around, but it is going down. The safety and conditions of where we live, our interactions with friends, family, neighbors, coworkers, financial problems, and a biggie, caregiving responsibilities. Some of you may be in a situation of caring for an elderly or infirm parent or a handicapped adult child, and it is an ongoing stress. Now, Hans Selye first came up with this term, the general adaptation syndrome, long ago. And there are 3 stages. This is the collection of responses we have, a 3-stage response to a stress. So the first stage is the alarm reaction stage. Hormonal surges increase, cortisol, adrenaline. Your heart rate speeds up, your respiration speeds up, your blood pressure goes up. It's the fight or flight reaction, and I'll talk more about that in a moment. If the stress continues, then we go into the stage of resistance. The body adapts to the chronic stress and is no longer in a state of homeostasis. Homeostasis is when you are not stressed. It's elevated. The arousal is still there, but not quite as extreme as in the alarm reaction stage. And over time, this depletes the immune system. Finally, if the stress continues long-term, we reach a state of exhaustion where our energy stores are depleted and our immune system becomes compromised, leading to exacerbations of illness, maybe even new illnesses, and even death. So let's look at the alarm stage, fight or flight. Again, life is not all good or all bad. So stress is not all good or all bad. Why do we have the fight or flight? Well, it goes back to ancient times, and you still see it in the animal world in particular. It developed in response to a perceived threat. A wild animal approaches your dwelling, or a warring tribe attacks your tribe, or today, we see a mugger approaches us in a dark alley or whatever. So our body is on high alert, red alert, fight or flight. If you can fight, do so. If you can't, get out as fast as possible. Today, we still feel it. Sometimes we see a child dart into traffic after a ball, or we see a speeding vehicle going out of the lane. And we have all these reactions where our body is on high alert, and it helps us to respond very quickly, promptly, and as effectively as possible. In the stage of resistance, it can't be sustained for too long because it is draining the body's energy stores. So it again impairs our ability to deal with new stresses. So it's kind of like a domino effect. We don't respond well to this chronic stress, and then we we get angry and irritable or avoid dealing with other things that come up, and we create increasing numbers of problems, and we become more and more vulnerable to illness and ill health. The state of exhaustion, we hope we don't wind up there, but some of us have at times. It's where you're so drained that there's a strain on your cardiovascular and your immune system. And over time, this can change the rhythms of your heart. It can raise your blood lipids, which can cause, risk factors for hypertension, heart attack, stroke, and it also can cause us to engage in all kinds of unhealthy behaviors. So the impact of chronic stress, as you've seen, may contribute to or worsen a range of diseases and disorders, including asthma. And it's also been linked to depression, anxiety, and other mental illnesses. I think you would agree with me that if we have a challenge in life, let's say a problem at work comes up, but we problem solve, we figure it out, we get through it. It's a little stressful, but we get through it. But if you have an ongoing condition that does not resolve itself over time, it can lead to a host of mental health problems. In women, it often manifests as depression. In men, it can manifest as rage also. So here are some of the physical signs of chronic stress. So let me ask you, unfortunately, we don't have time for me to do it all in the chat room. With my classes, I always ask them. Changes in appetite go in one of two directions. Some people, when they're stressed, let's say they're going to give a big presentation, they have something coming up that they're very nervous about, changes in appetite. Some of us can't eat, lose our appetite. I'm in that category. Something really stressful is coming up, I can't eat, or I even skip meals. I forget, I'm just working. Others overeat and eat things they shouldn't, like junk food, fried food, things that they know are not really good for them. So identify to yourself which group you're in. Most people fall in one of those two categories. Everybody has some response in their appetite. Some people get indigestion too, which makes it very hard for them to eat. Second, changes in sleep patterns. Again, these follow a similar trajectory. So some people, when they're stressed out, when they're feeling really intense stress, they have insomnia. They either can't fall asleep or wake up in the middle of the night in a state of worry about what the stressor is that's causing their anxiety. And the other group stays in bed and avoids the whole thing. Calls in sick to work, doesn't want to go out, just chills and not going. It's not really chilling, it's avoidance. So these are the two sleep patterns. Muscular tension. We all sometimes have muscular tension and respond to stress. We take it in different places. 65% of Americans have chronic lower back issues. So I am not one of them, fortunately. That's a very common place to take it. Some people, I know I take tension in my shoulders and neck. Some people take it in other parts of their body. There's TMJ, you could take it in your jaw, your mouth. So it's important to identify your patterns, and we're going to do that. I'm going to show you a technique for doing that in a moment. Your heart could be racing. You could resume unhealthy habits such as tobacco use, vaping, alcohol use, bite your nails. Okay, other emotional signs of chronic stress. When you are constantly worried about either what happened before or what's going to happen in the future, you're not in the present. You're actually in a state of worrying about the past, projecting the future, and so your concentration goes out the window. You can't focus as well. And that, of course, can cause all kinds of problems, not just at work. You could get in a car accident. You could fall because you're not paying attention when you're going up steps. You're in a mindset of constant worry. You can become irritable and angry, nervous, restless, tired. You might find yourself crying for no apparent reason. And worst of all, you could isolate yourself from others, so you're not getting any support for this increasing drain on your resources. So we can think of chronic stress as sort of a toxin that permeates our entire body and triggers a negative cascade of results. This was from the NCCIH. This is an excellent resource. I strongly recommend it. It's the National Center for Complementary and Integrative Health. It is part of the National Institute of Health. There's a lot of really good information on NCCIH, and I will provide a reference list at the end. So if you'd like to do further reading, please do. So the impact of stress on chronic disease can be devastating. The release of histamine can trigger severe bronchoconstriction asthmatics, severe allergy responses, risk of viral infection is increased, plaque buildup in the arteries is increased, insulin needs change in diabetics, stomach acid, it becomes more concentrated, and their feelings of being out of control, which can lead to anger, depression, sadness, feeling overwhelmed, like there's no way out. I put this in because some of us might fall in this category of broken heart syndrome. It's also known as stress cardiomyopathy. It occurs when someone experiences a sudden and severe acute stress. It can rapidly weaken the heart. It could be grief, when someone dies, fear, extreme anger, surprise, or it can result from an acute illness that gives you a high fever, stroke, seizure, significant bleeding, or a severe asthma attack. It can be life-threatening, causing congestive heart failure, low blood pressure, shock, and heart rhythm abnormalities. You should seek medical care immediately. I'm saying this because some of you are in this category. The vast majority of people with BHS are women in their 50s and older, 50s, 60s, 70s, 80s. The risk for women, postmenopausal women, is 5 times greater than that for any other group, younger women, men of all ages, or children. So if you are in that group and you're feeling very stressed, I hope you implement some of the stress management techniques we're doing today. It can literally help your heart and perhaps save your life. And again, this does not replace medical care. It is an adjunctive or complementary therapy. So we've seen the mind has a powerful influence on the body. In fact, it's hard to believe for those of us that have underlying issues. I have severe allergies. I do not have asthma, but I literally can sit on a bench, as I did the other day, and immediately break out in hives because there was either a cat on the bench or something else I'm allergic to. I immediately went home and took Benadryl, and I was okay. I wasn't carrying any on me, which I should have been. So it's kind of like walking through a minefield. You don't know if you're going to have an allergy attack, an asthma attack, but our mind plays tricks on us too. So there was a study that showed that patients with moderate to severe asthma exhibited severe symptoms when they were exposed to saline mist that they believed were powerful allergens. It was just saline. They exhibited a prompt recovery after the use of a saline inhaler that they believed to be a beta agonist. So the mind has a powerful influence. This surprised even me, and I've done a lot of reading in stress management. Even standard skin test reactions were modulated by the mind. So, you know, those skin test reactions, you've all had them, that there's subcutaneous injections and they see if you have a reaction. In one study, patients with dust mite sensitivity who were skin tested after viewing a funny video demonstrated lower reactivity than did patients viewing a kind of boring weather documentary. So there you have it. It's hard to believe, but it is true. And so we can control our reactivity and our symptoms to some extent by reducing our stress and controlling our mind, because the fear of a flare-up, an allergy attack, or an exacerbation also affects us. If we're calm, peaceful, and believe that we have some control over our outcome, we're going to feel a lot better. So complementary therapies, and this is with an E, not an I, although in my case, these are both. I chose ones that are free for you to do at home, safe and free to do at home. There are many that involve paying money, and that's fine, but I wanted to give you tools that you can use immediately. So the mind-body practices is going to be our focus for the rest of this presentation. Nutritional supplements, particularly probiotics, are very popular. I'm not going to comment on that. And before beginning any nutritional supplements, if you do that, you should consult with your doctor or your practitioner, because everything that you ingest interacts with other things. So for example, when you're undergoing surgery or a procedure, the doctor should ask you, are you on any supplements? Because it can interfere with some of the medications. Likewise, if you're on an array of medications for asthma or other diseases, you need to check that there is no adverse interaction between your supplements and your medications. I know I always tell my doctor everything that I'm taking, so it's really important to do that. Chinese traditional medicine, including acupuncture, I've tried it myself for many years. I can't say I enjoy the needles, but it is very effective for certain things. I find it's very helpful for connective tissue issues like a strained tendon, but I'm not advocating Chinese traditional medicine today, and we are not going to be doing it, obviously. Dance, music, and art therapy are 3 very enjoyable complementary therapies. I know they use them at Sloan Kettering, Memorial Sloan Kettering Cancer Center. My daughter had cancer as a teenager, and thanks to their excellent care, survived and is fine today. And the therapies there are outstanding. So they're used in a variety to treat a variety of diseases, and they're wonderful, not just for adults, but really great for kids and adolescents. Journaling is another complementary therapy. A form of journaling is called expressive writing, can be very helpful getting over a traumatic event. We're not going to be doing that today. I may do it if there's enough interest on my new YouTube channel. Energy work, such as Reiki or healing hands, can be very beneficial. We are not going to do that today. You have to go to a certified practitioner. Healing hands is often done by RNs or NPs. In medical facilities, Reiki is done by different practitioners. Just make sure the person has credentials. We are not doing that today. Massage can also be helpful. Again, make sure that it's a licensed massage therapist, whether you choose Swedish, shiatsu, or Thai massage. An osteopath or a chiropractor are two types of complementary therapists that are often sought out. I'm not going to speak about that today. I just wanted to put it on the list so that people say, oh yes, I know that is a complementary therapy, but I just wanted to try and have a fairly comprehensive list. Now, what we're going to be talking about for the rest of this presentation is complementary mind-body therapies that you can do safely at home. And you can do it for free. You can subscribe to some channels or there are practices of Qigong, yoga, and other things that you can sign up for, but it is not necessary. So body scanning is first doing a very thorough scan of your body, just closing your eyes and going through your body. It's good to go from the feet up, every part of your body, and identify, where do I have pain or discomfort? Progressive muscle relaxation, which we are going to do today, is releasing tension from the muscles. Sometimes we don't even realize how much tension we're holding until we contract the muscle and release it. And you're like, wow, that feels so much better. I didn't even realize that my shoulders were up to my ears, because I'm used to it. We're going to do yoga breathing, which is known as pranayama. Breathing techniques are among the most tested of complementary therapies. They have been, in many studies, shown to be not only effective in stress management in general, but also effective, particularly for those with asthma. Qigong. Qigong is an ancient Chinese practice. Some of you may do Tai Chi. Tai Chi is sort of the great-great-great-great-great-great-granddaughter or grandson of Qigong. Qigong goes back an estimated 5,000 years and was done by Shaolin warriors, and is done by hundreds of millions of Chinese today. You often could see, or we used to see, pictures of Chinese just out on the square doing standing, they call it a standing meditation. It's very gentle, anybody can do it. It's not strenuous like yoga postures. And there are many forms of Qigong. We're going to do a few simple Qigong exercises today. Those of you that were at the summit, no, I did just a little wellness activity with a bit of Qigong at the beginning of the summit. Meditation using guided imagery. There are different kinds of meditation. Meditation is about relaxing the mind. In progressive muscle relaxation, we relax the muscles and the body, but sometimes the mind is really tight. The meditation helps declutter and relax the mind, and the guided imagery can help with that. Two other mind-body therapies that I enjoy myself are aromatherapy and journaling. Aromatherapy is wonderful. Aroma is one of our most primal senses. It's how animals know what's good, what's not, what's poisonous, what's not. It's how animals, if any of you have dogs, they know if someone's a good person or not. I always used to trust my dog, if they didn't like a person, I'm like, okay, there's got to be a reason, right? And then animals in the wild can identify poisonous versus edible plants. So aroma is also 90% of taste. It's a very powerful sense. So aromatherapy can be used to alter your mood and to relax you. I strongly advise against any of the chemical air fresheners. Those are not aromatherapy. Aromatherapy is 100% plant essence. And the two major companies that I think are fully vetted and evidence-based are Young Living and doTERRA. I've used both, they're excellent. 100% natural plant essence, but it does cost some money, and I can't do it today, obviously, but it's a nice way to change mood. If you get scented candles, make sure they're aromatherapy, not chemical, artificial scents. Some of them can even trigger an allergic reaction or an asthma attack if they have certain types of chemicals. Journaling, again, writing things down can be very helpful. That is a subject of another day, though. So we're going to start by identifying where we hold stress in our body. So let's just do a brief body scan. Let's close our eyes and uncross your legs, uncross your arms. We're closing our eyes so we're not distracted by visual stimuli in our environment. And let's go inside our body. Most of us know where we tend to take tension, whether we tend to have indigestion, achy calves, lower back problems, neck aches. But let's do an actual inventory, because our body changes from day to day. We are not a static being. We are a dynamic being, always changing. So let's think about now our feet, our toes, metatarsal, heel, ankle. Have you been having any issues there? Perhaps you have an old injury, sprained your ankle, and it flares up when it's rainy or humid. Do you have any issues there? Let's move up the legs, the calves, the shins, the knees, the thighs. Do you have any pains in those areas? Have you been experiencing any discomfort, muscle cramps? And let's go up now to the lower torso, the groin area, the buttocks, the belly, inside and out. Have you been having GI problems? Have you been experiencing sacral problems in your lowermost part of your spine? And let's move up now to the mid-torso, to the rib cage, again through the GI tract. You can have problems anywhere in your GI tract, to the central back, to the lumbar. Lumbar issues are very common. 65% of the people, as I said, have lower back issues, and most of them are in the lumbar area. Do you have any problems internally? Moving up to the upper torso. I think all of us with asthma, allergies, or other respiratory issues will identify that we have problems with the airways, with the lungs. Are there any other areas there? What about your trapezius? Do you have a rotator cuff injury that sometimes still acts up? And now going down your arms, your shoulders, your upper arms, your elbows, your lower arm, your wrist, hands, and fingers. Are there any areas that are weak, stiff, sore, muscle cramping, joint pains? And now going up the neck, the front, the back, the sides, the inside. Do we have any issues in these areas? Have we been experiencing sore throats, tightness in the throat? It can be physiological, it can also be a result of stress. Now let's move up to the mouth, the teeth, the jaw. Many people take tension in their jaw and have TMJ. Some people grind their teeth. And sometimes this only happens when you're feeling overly stressed. Let's go up to the nose. I think most of us have issues here with rhinitis and sinus problems. I know I do. And the sinus passages, the eyes, forehead, the scalp, hair, ears, and down to the occipital area where there's a lot of stress in many people at the base of the skull. Now make a note of where you feel you have tension, pain, or discomfort, and open your eyes. Okay, we're going to keep this in mind as we go to the next exercise. We can release a lot of bodily tension using progressive muscle relaxation. I recommend doing it at least several times a week. It only takes a few minutes. In fact, you could do it every day. At the end of the day, it feels great. I'm going to invite you, if you are in a place where you can do so, to lay down on your back. If you are not in a place to do so, just sit comfortably in your chair with your feet touching the ground and your hands relaxed, no crossed arms or legs. Again, we're going to close our eyes if you wish when we're doing this, just so we can fully concentrate. And I'm going to back up just a little bit so you can see my full arm. So we're going to start we're going to contract one body part. This will be the arm. So we're going to contract it like we're punching something as hard as we can, hold it to a count of 8, and then release. And when we release, we don't just sort of let our hand go down while we control our muscles. We drop. So make sure you're not going to hit your hand on anything when you do this, like a hard tabletop. Okay, so we're going to work our way from the limbs to the torso to the neck and head. Again, if you can lay down, that's optimal. If you can't, just sit in a chair. That's fine too. We got to do what we can when we can, right? So shake out your arms, legs. Make sure you're not stiffening them. Okay, we're going to take our right arm. Bring it up a few inches off the floor or off your chair. Make a fist and stretch it really hard, like you're about to punch something as hard as you can. A punching bag, and hold it. 1, 2, 3, 4, 5, 6, 7, 8. Drop. Release all tension. You might wiggle your arm a little side to side and just let it flop. If you're lying on your back, it should end face up. The palm will be face up and the fingers might be slightly curled. Don't adjust them. Now imagine that all tension is rolling off the right arm, wrist, hand, and fingers. Imagine all toxins, all unhealthy conditions, old injuries discharging, and allow the muscles to completely relax. Do not use any muscular energy to hold your arm where it is right now. Now we're going to turn our attention to the other arm and hand. So lift up your hand and arm a few inches off the chair or floor and make a fist, a tight fist. Straighten the arm and hold it. 1, 2, 3, 4, 5, 6, 7, 8, and let all tension drip off your arm like water off of a tree branch after a rainstorm. Imagine all tension, all toxins, all negative thoughts. We have negative thoughts too. I know I sometimes think about my wrist injury that it was years ago that flares up. Don't think about it. Let it go. Let everything go. Allow your arm to rest palm up. Very gentle, no muscular tension. I can't show this, but I'll talk you through it. We are now going to lift our leg, flex our foot, and hold the leg out a few inches off the floor or away from your desk, wherever you're sitting, and like you're kicking something really hard, and hold it. 1, 2, 3, 4, 5, 6, 7, 8. Drop. Wiggle the leg a little side to side and let it flop, however it wants to. Don't place it, just let it happen. If you're laying on your back, probably the toes will point out a little bit. And if you're sitting in your chair, just let the foot flop back on the floor. Imagine all the tension, all the negative thoughts, negative experiences associated with this leg are just dripping off the leg like water off of a tree branch after a storm. All the energy is now cleansed, getting rid of all that negative energy, all the tension in your leg. And let's turn our attention to our other leg, whichever one you did, the other one. Flex your foot, straighten your leg, lift it a few inches off the floor, and hold it as hard as you can, like you're kicking something really hard. 1, 2, 3, 4, 5, 6, 7, 8. Drop. Wiggle your leg a little bit and let it just flop. If you're lying on your back, the toes will point slightly out. Imagine all tension, all negative thoughts or associations with this body part just exiting the leg. Try not to use any muscular energy to hold this leg in place. Let it just flop. Now we're going to turn our attention to our torso. This one's a little challenging in a chair, but it can be done. We're going to divide the torso in 2 parts. So we are first going to turn our attention to the lower torso. Now, I want you to imagine that you have hooks on your hips. You're going to tense your buttocks and lift your hips up toward the ceiling. The rest of your back stays on the floor. Just the buttocks tense and the hips lift, and hold it. 1, 2, 3, 4, 5, 6, 7, 8. Release. I like to pretend I'm at the beach. You know how you make to make a nice imprint in the sand, so just squish around a little bit and then let your buttocks and your lower torso relax. All muscular tension gone, front, back, and inside. Release that part of your body. We take a lot of tension in our gut, as I'm sure you're well aware, so this helps that as well. Now we're going to work on the upper body. So this time I want you to imagine that you have kind of a fish hook right here on your sternum, and you're going to squeeze your shoulder blades together and lift your sternum toward the ceiling, whether you're sitting or laying down, and hold it. 1, 2, 3, 4, 5, 6, 7, 8. And drop. And after you release again, you can do the same thing. Pretend you're in the sand at the beach and just kind of rub your shoulder blades against the floor or the chair and then relax them. We take so much tension in our back. We weren't really originally intended, I guess, to be sitting as much as we are. We were meant to be more active, standing and doing things, but we wind up sitting in a chair for a good part of the day, many of us, and it's really not so great for our back and shoulders, especially if we don't have a really wonderful chair and desk. So anyway, and I know I tend to do work on the fly, so you sit wherever you sit, and it's not necessarily the most healthy chair. Okay, now we've relaxed our whole torso, arms, legs. We're turning our attention to our neck and our head. So, and our shoulders, upper shoulders. So we're going to do them all together. We're going to lift the shoulders, scrunch the neck, and scrunch up the face like a prune, like you just tasted something really awful, and hold it. 1, 2, 3, 4, 5, 6, 7, 8. Drop. Just let your head go side to side like one of those bobbleheads, you know. Sometimes we take so much tension in our neck and our jaw. I know that's a place I have to be aware of. Open your mouth and just move your jaw side to side and let it float back to center. If you are someone with TMJ or teeth grinding, it helps to put the tongue on the roof of your mouth, particularly when you're feeling kind of tense. It prevents the teeth from locking. Okay, so this progressive muscle relaxation can also be done with visualization. It can be extended. I hope you enjoyed this. And you can now get back in your chair, or if you want to stay laying down for the rest of this presentation, that's okay too. Now we're going to do some yoga breathing, pranayama. This relaxes the airways and the diaphragm, and it really is very helpful, not only for those with asthma, but particularly helpful for those with asthma. So yoga is a body-mind or mind-body practice. It's both. We're doing the mind-body. The body-mind is more the asanas. I guess the breathing is a combination. But yoga has several branches. The 3 main ones that we're going to talk about today are pranayama or breathing, asanas or postures, and meditation, control of the mind. And together they help us achieve a state of peacefulness and optimal health. We're not going to be doing asanas today. We're going to be doing breathing, and hopefully, if we have time, some meditation. Many studies have shown that regular yoga improves the quality of life as measured by the Asthma Quality of Life Questionnaire. It can also reduce symptoms. So, the yoga breathing helps relax the muscles surrounding the airways and the diaphragm. Again, when we're exposed to a trigger or we're anticipating something, we tighten up. So this helps to relax the muscles. Now, I encourage you, if at all possible, use nose breathing, breathing in and out through your nose. This is associated with a reduction in nocturnal symptoms and exacerbations because the nose acts as a filter, filtering the air that's going in, moisturizing it, and warming it. Mouth breathing is common during acute asthma exacerbations. If you are very stuffed up, then of course breathe through your mouth, but try to do it through your nose if at all possible. Okay, so I want you to focus on this beautiful flower. And this time, this is going to be done seated. I mean, if you really want to, you can do it laying down, but there's a danger you might actually fall asleep. So let's see if we can do it seated. Let's put our hands on our belly. Now, our belly is an area that has a lot of mind associations. I won't say who, but many people wear tight jeans, shape-ups. In the olden days, our mothers wore girdles. We're always sucking in our gut. We don't want to have any stomach showing. We don't want to, let that go at all. And so we take a lot of tension there. And then it's also our GI tract, the bottom part of our GI tract is there. So anybody with digestive issues or takes stress through indigestion, that's there too. So if you close your eyes, you will not see your belly expand. You will not be judging yourself and thinking that you have a big belly. So I suggest you close your eyes when doing this. Lightly place your hands on the belly. The first step of deep breathing is belly breath. Many people, I'd say most people, do not breathe into their belly at all. And this is the first step in oxygenating and relaxing your body. So we're going to imagine that as we breathe into our belly and it expands, it's going to expand like a balloon. And I want you to imagine a white or golden light expanding the belly, a healing light. I like to think white, like, almost like a laser, a healing energy, okay? Or if you're religious, you can think of it that way. as healing coming from another source, but whatever works for you. If you have another color you particularly like, you can use that. But I think white, golden have good connotations of healing. So I'm going to use white light. So we're going to breathe in. And another thing that's been shown to be effective in yoga breathing for asthma is to do breath holding. Not extreme, but I'll show you what I mean. So we're going to breathe into the belly, expanding it. Keep your hands there so you can feel the belly going up. Breathe in 1, 2, 3, 4. Pause. Breathe out, slowly lowering the belly. 4, 3, 2, 1. Squeeze the belly button to the spine. If anybody is pregnant, please don't do this. Everybody else can do this. I forgot to say that. Squeeze the belly button to the spine. So when we inhale, it's gradual, and when we exhale, it's gradual. A lot of times I see people when they're learning this, they breathe in slowly and then they just go, no, it has to be in slowly, out slowly. That is part of the relaxation response. Some people even do breathing that is twice as long exhaling as inhaling, but that's a little difficult. We're not doing that today. So let's try it again. We're going to hold it in this time for a count of 4. 4 counts to fill the belly as much as you can. Hold it filled for 4 counts, and 4 counts to lower it down. Imagine it's like a balloon that has a little pinprick in it. The air doesn't come out rapidly, it comes out slowly, and to get all the air out, you squeeze it. That's what we're going to do. We're going to let the air out slowly out of our belly and then squeeze it out like wringing a dish rag by pressing our belly against our spine. So let's try a few of those belly breaths, or it's called natural breathing. So we're going to breathe in, imagining we're filling a balloon of white with white healing light. Breathing into the belly. 1, 2, 3, 4. Hold. 1, 2, 3, 4. Exhale slowly. 4, 3, 2, 1. Squeeze the belly against the spine. And again, breathe in. 1, 2, 3, 4. Hold the belly full. 1, 2, 3, 4. Exhale slowly. 4, 3, 2, 1. Squeeze the belly button against the spine. And as you breathe in, relax for a second. As you breathe in, you imagine you're filling it with healing white light. As you breathe out, imagine that all negative energy, toxins, self-judgment, negative thoughts exit the body. You're eliminating them energetically. Okay, let's try this again a couple more times. Breathe into the belly. 1, 2, 3, 4. Hold it in. 1, 2, 3, 4. Exhale out. 1, 2, 3, 4. Squeeze the belly button against the spine. And again, breathing in healing white light, filling the belly. 1, 2, 3, 4. Hold it full. 1, 2, 3, 4. And exhale out. 1, 2, 3, 4. Squeeze all the breath out. This time, belly breath is the first and easiest form of deep breathing. We're going to see if we can extend the breathing to the diaphragm. So we breathe into the belly and then we expand the rib cage, hold it in, and then exhale out of the rib cage and the belly. The breath always goes in from the bottom up, like filling a pitcher, and goes down from the top, and you pour it out like you pour a lemonade out of a pitcher, from the top down. Ultimately go into 3-part breathing, which is the most relaxing and wonderful breath. We do belly, rib cage, chest, but I don't think we have time to fully do that today. But I do want to try the diaphragmatic breathing because it's so helpful for people with airway issues. So we're going to add on to the belly breath, extending and expanding the rib cage. Let's just try it. It takes a little practice, so if you don't get it immediately, don't worry, you can practice on your own. Hands back on the belly. So by 4, you should be expanding into your diaphragm. So we're expanding the belly, 1, 2, 3. Rib cage, 4. Hold it in, 1, 2, 3, 4. Exhale through the diaphragm, belly, 3, 4. Squeezing the belly against the spine. Let's try that one more time. Breathing in, 1, 2, 3, 4 goes into the diaphragm, expanding the diaphragm, holding 1, 2, 3, 4. Exhaling out, diaphragm, belly, 3, 4, and squeeze the belly against the spine. Okay, this breathing can actually go on for much longer, but I know I see the time is going on. It's if you're going to do into the diaphragm and the chest, it's best done laying down. Belly breath can be done anywhere. You can take a little break at your desk and do it for a few minutes. It's very relaxing, and it helps stabilize if you're feeling stressed and you feel your heart's racing, your respiration's racing. You can just calm everything down, mind and body. Okay, one more thing I hope we have time for here. I've done a little bit of Qigong at the last couple of summits. Qigong is a mind-body practice from China that balances one's vital life force, or qi, using graceful movements, deep breathing, and a mental focus. It boosts the immune system, and it helps you to conserve your health and resist disease. So let's try a short Qigong exercise together. So we're going to stand up. Let's just rub our hands together so you can feel the qi, the energy. As you separate your hands, you can feel the energy between your hands. I have a pretty high energy field today, so I can separate them quite far and still feel the connection. You can feel a kind of tingling or buzz. Sometimes it's associated with the temperature, hot or cold. Don't be alarmed by the temperature changes. This is your energy, or qi, and let's just take this energy and wash it down in our body. In the interest of time, I'm going to shorten this a bit. So we're going to do waterfall hands up, open the chest, bring the chest forward and opening the airways, bringing the hands back forward and hands down. With breath, let's try that. And it's very soft. It's not muscular. It's as if you're being lifted like a puppet on strings. The wrists come up. Breathe in as the wrists go up. Exhale. Inhale. Inhale. Exhale. Inhale. Exhale. Very softly. Again, if you can do it through the nose, that's ideal. If you can't, that's okay too. I want to teach something new. I was going to do what we did at the summit, but we don't have time to do all of that. So I'm going to do what's called cloud hands. It uses a figure 8, which is a very good and restful shape, because what you're doing is you're gently contracting and releasing the whole diaphragm as you do it. So cloud hands starts in Uji, we call it Uji posture. Your arms are slightly bent, hands are high, where your legs join. And we're going to turn the left and the right arm like a cloud in the sky. Rotate to the other side and switch hands. Breathe in as you shift sides. Breathe out as you change. And your hands follow the focus. Imagine you're laying on your back looking at all the shapes in the clouds. We all did that as kids. Sorry, I would do this very slowly, but we're running out of time. I'm giving you a sample, just a sample. Shift very gently. Feet are apart, hips width apart. Now you can make it a little more flowy until you find yourself leaning into it, and then the figure 8 kicks in. Remember, it is the symbol of infinity. So if you see I'm leaning into it a little bit, it becomes a figure 8. This can be done for several minutes. It's a very relaxing exercise, and Ideally, if you can do this outside by a body of water, that is optimal, but you can also do it in your office and have a few minutes. We're going to open our hands and we're going to seal in this energy so it doesn't just go out into the world. We want to keep the energy in us right now. So we're going to bend and cross the arms. Exhale down. Exhale down. Down. Up. One more. Exhale down. Inhale up. We're going to bring our arms back to Wuji stance and then cross the thumbs, bring the feet together. We end our Qigong practice always with the feet together. And it's nice to also link the hands so we close our energy circuit. And we sway a little like bamboo. Many of you have been to Murakami, there's a bamboo garden there in Delray Beach, Florida. Bamboo is so strong, it grows so rapidly, and it bends, it does not break. So let's imagine ourselves as strong, supple, and resilient as a bamboo. Okay.
All right, thank you so much, Dr. Weiss. It looks like it's time to move on to
Hold on, Shelby, I just want to conclude with one thing. I need to say this, I'm not going to do it. Okay. The final thing that I was going to do, and this will be the subject of another webinar, obviously, is to help you learn meditation. I think this is harder than the other practices. I practiced other yoga, Qigong, and other things for years before I could really meditate. So there are different kinds of meditation. Concentration meditation is good for beginners. You can focus on just a candle, try and get all the other worries out of your mind. Loving kindness, you can focus on love towards yourself and ones close to you. And mindfulness with guided imagery is what I was going to do. Let me just say, meditation is misconstrued. Some people think you sit on a mountaintop and just leave life. No, you declutter the mind. If any of you remember Mary Poppins, when she suddenly cleans the room up, all the clutter, she doesn't throw the toys and the clothes out. They're filed away neatly in the drawers. So we're decluttering our mind. We have thousands of worries and thoughts everywhere. We're going in the past and in the future. It puts us in the now, in the present. The thing with meditation is it does take practice. Ideally, it should be done twice a day. But even if you can only do it once a day, even a few minutes helps. So ideally, to actually change yourself profoundly, 20 minutes twice a day is recommended. Think of it as a surfboard. Some of you surfers, the mind is like an ocean. The ups and downs of our lives are the waves. And rather than getting battered by the waves, the meditation gives us a wonderful surfboard so we can ride it like a skilled surfer. It doesn't get rid of our problems, it helps us to navigate them successfully. I was going to do a meditation to this, but I will have to conclude. The references will be, you'll get a copy of this. So these are some references. There are many, many references. I thank you very much for your time. Anybody has any questions?
Thank you so much. It does seem like we do have one question in the chat, and it looks like it is from Sarah Robinson. Dr. Weiss, do you have any recommendations for essential oils when they tend to trigger asthma?
Well, I'll tell you what I use for myself. First of all, it has to be pure. You do get what you pay for. The two that I know that are 100% pure and thoroughly tested are doTERRA, DOTERRA, and Young Living. And I think in Florida, doTERRA is the more popular one. If you can feel free to email me if you want some more information on that. They're not cheap, but a little goes a long way. It's very, very concentrated. So unfortunately, the cheap ones you get at Publix or at other stores, they're just chemicals, and they actually can be detrimental. It's better to use nothing than that. Dr. Wanda and I were talking, and she said she likes to bake with cinnamon. That's another way of doing it. If you love cinnamon and vanilla, bake with that, and your whole house will be permeated with that wonderful smell. But for airways, I like to use eucalyptus oil. That's very good for clearing out sinuses, especially if you have asthma or rhinitis or anything, allergies, that's good. Also, when you get a cold, it's very good. Peppermint is my go-to. I bring peppermint with me all the time. Not only does it keep my sinuses clear, but I put a little on my temples and under my nose and wrists. And if I'm driving long distances, which I frequently am, or at night, it keeps me alert. And I would say if you want 3, peppermint oil, lavender oil is the go-to for relaxation. There's a lot of fake lavender out there. You got to use the real thing. It is extremely relaxing. You can put a couple drops under your pillow or on your pillowcase at night or on a sachet. I use it. There's an aromatherapy facial massage, which I use a combination of frankincense and lavender. Frankincense is kind of expensive, but again, I use it sparingly. But I think lavender and peppermint oil are not that expensive. They're wonderful, and eucalyptus can't be beat for clearing out the sinuses, you know. So lemon is also a good purifier. You can put it in purified water and spray it around your kitchen instead of using these chemical sprays, and it helps purify the air, especially if you have pets. I have an old, rather fuzzy, shedding rabbit. So I spray that around the room, you know, doesn't hurt him, and it kind of clears out the air. So.
Thank you so much for answering that question. And it looks like in the chat, there were also praises for lavender oil as well. So it looks like we have about 5 minutes remaining. Please feel free to drop any additional questions in the chat. Dr. Weiss, there's lots of praises for our presentation today. So thank you again for your time.
You're very welcome. I just really scratched the surface. It was hard for me to select because this could be, you know, even I've taught a whole semester on this and you still don't cover everything. There's new things coming out every day. I do warn you against infomercials. There are a lot of infomercials out there. When someone's selling a product, be very wary. They're trying to sell the product. Whether it has benefits or not, you're shelling out a lot of money to basically make this person wealthy. You know, I'm not selling anything, and for my YouTube channel, it will be free. I like to share what I've learned from experience, because stress can be devastating. It can really wreak havoc on your health. And we have at least 2 stressors. You know, most of us have either asthma or some other respiratory issue, and we've got COVID for 2.5 years, and we've got high gas prices, and we've got high housing prices, you know, and the list goes on. So life is not always so easy. And, but again, rather than trying to block it out with drugs, alcohol, you know, avoidance behaviors, we have to get that surfboard, you know, and these techniques give you that meditation, relaxation. You want to elicit the relaxation response. Meditation is more profound than the other therapies in that it can actually create new gray matter in the brain if you do it seriously, intensely, twice a day over long term. I work with researchers from Harvard Medical Center, and I was part of this project in the Berkshires. And it's amazing. They showed that people that are really serious long-term meditators can create new synapses in the brain. And that goes counter to previous thinking about neuroplasticity and what the brain is capable of. You know, we think, oh, we start going downhill after a certain age, you know, and the brain starts going. We're trying to prevent Alzheimer's or dementia or whatever, but you can actually create new gray matter in the brain through deep meditation. That's pretty amazing. And to really learn to do it well, you might have to go with a teacher. But I suggest for those of you that want to try meditation, I'm going to be doing it on my channel, start with concentration meditation. It's the absolute easiest. Dim the lights in a room or turn out the lights, light a candle, and focus only on the candle. You'll see all these amazing colors as you stare at it. A pretty big candle would be helpful. And just try and clear your mind of anything else. It's like sweeping up your kitchen, you know, you're cleaning it of all the little dust and stuff that fell on the floor of your mind. And you can also do some deep breathing techniques while you're doing this concentration meditation. For other types of meditation, you really need some instruction, and we'll stay tuned for that.
All right, well, thank you so much. For one final quick question, Dr. Weiss, do you have a website where people can check out your information?
I don't have one on stress management. That's why I'm starting the YouTube channel. For those that don't know, I've been very, how can I put it? I was going to say torn in several directions. I have a seriously multiply handicapped autistic daughter. I had to come back to New York to take care of her. I also have a demented mother in failing health. She's been going downhill since my father died from COVID. And I have several different jobs. So I have not really been able to do what I'd like to do, which is to start a new website with all this wonderful information. That's why I think it's easier. My son's going to help me start a YouTube channel, because I actually was going to originally do my doctoral research on meditation, but it's very hard to get a significant response because it does require quite a large amount of time, and most people don't want to give that amount of time to a study. So I actually had the New York Philharmonic interested in doing it because classical musicians are highly stressed physically and and mentally. There's huge competition for a few spots. And then, I had 2 violinists in the pit who lived across the street from me, and they were constantly getting stress injuries from just the way they held the violin. So I was going to do an initiative, but Lincoln Center was undergoing renovation, and the whole thing didn't happen. And then I met somebody who turned me on to doing asthma research, and the rest is history. But I have a very long-standing and deep interest in this, and I've used it myself as a surfboard because I've had a lot of challenges in my life. My daughter is not only autistic and multiply handicapped, she had cancer as a teenager. So, how do you get through this? You get through it by trying to modulate your responses so you don't flip out. You have to stand the course. You have to do what's needed. I've learned an enormous amount. I think our greatest obstacles are our greatest teachers, and I have learned an enormous amount, and I'd like to share it with others, maybe to relieve some of your suffering or prevent some of the things that might happen if you don't know how to get tools to manage your stress.
Absolutely. Well, it looks like it is 1 p.m. right on the dot. Thank you so much, Dr. Weiss, for presenting, Dr. Rodriguez-Dunham for the introduction, and all the attendees that joined this afternoon. Please note, for those that are eligible, 1 CHES credit will be available for the presentation today. You can find the appropriate Zoom or the appropriate link to the Certified Health Education Specialist evaluation form in the Zoom chat. If anyone has any questions about today's presentation, the Florida Asthma Coalition, or the Home Visiting Work Group, please feel free to reach out to flasthmacoalition@gmail.com. Again, thank you to all, and we hope you have a wonderful rest of your afternoon.
Thank you, everyone. Everybody have a great rest of the afternoon and the week. See you next
Thank you, everyone.
time.
Thank you so much. Feel free to email your questions. You can email it either to the Health Council or to me personally, dweiss@york.cuny.edu. I'd be happy to answer your questions. And stay tuned for the YouTube channel.